Welcome to the Postgraduate Medical and Dental Education Second Life Island. Professor Pramod Luthra from the Northwestern Medical Deanery, now part of Health Education England, established this island in 2009. Professor Luthra has kindly allowed us to work in his Second Life Island alongside colleagues from the Northwestern Simulation Centre. This island was originally developed to explore 3D simulation based training and how it could be integrated to the traditional education. The principles behind its use were to create cost benefits to the NHS by offering alternative problem-based learning that was effective and did not demand a high cost, nor releasing staff from the workplace. We are very grateful for the use of this island and acknowledge the invaluable support from Health Education England colleagues, Northwestern Simulation Centre and other Edge Hill University colleagues.
The Smith Clinic has an orientation and debriefing room and 2 consulting rooms. We spent some time discussing how to make best use of the space that we had, what size and shape the room should be, and how we should best furnish them. Advice from colleagues was that rooms should be as uncluttered as possible, as experience had shown that excess furniture can distract the students' attention from the real focus of the activity.
This group of students, 5 adult students, 6 mental health students and 1 child student, had just joined the MSc pathway at the beginning of Year 2 and were in the early stages of transition to Level 7 study. Students enter the MSc pre-registration programme at Edge Hill University having already completed a first degree and Year 1 of the BSc pre-registration nursing programme. They therefore enter the MSc pathway with key graduate skills that assume an ability to solve problems in a creative way and to learn independently. The students were at the beginning of their Year 2 practice learning module and preparing for a summative OSCE as part of the module assessment strategy.
The debriefing and orientation room is divided into 3 areas. As you can see from this area, whiteboards provide students with the information required to get started in Second Life and to navigate their way through the world. The information reinforces and provides an aid memoir that follows the formal face-to-face preparation session. The classroom area was developed to facilitate formal preparation sessions. There is an interactive whiteboard which enables internet access and a link to the module Blackboard site where all the materials required for the activity are held. It also provides a common alternative space for students to meet when they are not scheduled to be on campus, but where they may wish to get together when working on other group projects. In addition to the formal classroom setting, an informal space was also developed to enable students and assessors to discuss their performance following a period of observation. The 2 consulting rooms are identical, and it was envisaged that each housed a permanent simulated patient. As well as this, a computer, iPad and notebook are available for the student to use to access patient notes and test results. A blood pressure cuff is also available and will record blood pressure if activated.
Peer learning has a strong focus in the practice module to support the development of skills that ensure the students are able to meet the basic needs of all people who come into their care and the more complex needs of people within their field of practice. This scenario was designed so that all students would recognise their own field of practice, be able to share their developing expertise with their peers and learn new skills from each other. It aimed to prepare students for the complex and dynamic landscape of modern nursing, to respond creatively and innovatively, and to make decisions in challenging situations, as well as preparing them for their summative module assessment. The avatar was 17-year-old Lucy, who presented unaccompanied to Smith Clinic with symptoms that included a sore throat with severe pain on swallowing, extreme tiredness and anxiety. She had a known allergy to penicillin. The students had a variety of information available to them in the consulting room, including triage notes, electronic admission history, throat swab and urine test results, and blood test results, as well as the facility to check Lucy's temperature, pulse, respirations and blood pressure within the consulting room. This activity promoted critical reflection skills. For example, students were invited to consider their initial thoughts of Lucy's visual appearance and whether this subsequently changed as the activity progressed. Lucy was of slim build, wearing black jeans, a long-sleeved black denim jacket and flat shoes. Her hair was greasy and her clothes bigger and worn. She had not been taking care of her personal hygiene. In discussion, Lucy disclosed to the student that she had a poor relationship with her parents as they had not approved of her boyfriend. She was angry with them and tended to prefer to confide in friends of her own age. This had led to her having late nights out and drinking alcohol on weeknights on a regular basis. Her appetite was poor and she tended to prefer to eat fast food if she ate anything at all. Students needed to prioritise Lucy's needs, which included a confirmed diagnosis of glandular fever with a streptococcal throat infection that was sensitive to penicillin.